Well, good evening, everyone, and welcome to this 9th edition of Art Feast. You bet it's a benefit for the great Exalta Health, and we are here to spend a good hour with you to, well, showcase the many talents of the artists, sharing their work, looking for your donation, but bottom line, sharing a story or two, sharing those who are involved, volunteering their time, working with Exalta Health, and of course, convincing you that your time, talents, and treasures are very important to Exalta Health. And ArtFeast9 is as well. Of course, we are virtual and we are in these times, but we still certainly count on your support. So we're going to start strong with some 101s of Exalta Health. And of course, I turn to you. Glad that you are here. Ava Alexander. Eva, good that you are here, and I appreciate you because you are a board member. Eva, how are you feeling?
I'm excited. I am kind of nervous. This is my first Art Feast as part of Exalta Health. I'm a new board member. I joined late last year, and it was because of an event like this. It was actually their luncheon, which I'm sure we'll talk about later, but it was really just immersing myself in what this organization is doing for the community, is providing accessible, compassionate healthcare to everyone, and I really truly mean everyone. I come from an immigrant family. I come from a humble beginning, and being part of the community, not knowing where to go, who to turn to, was really challenging for my family. So knowing that I can now be in a position where I can support an organization like Exalta Health, who is helping families like mine, is amazing. Somebody said it before, it's a little bit of a selfish bit on my end. It feels good. It feels good to support, but I'm excited to be here. First time around, and I can't wait to see what all the artists have got.
Yes, Eva's first Art Feast 9. Here we go. And of course, we are talking through our barrier. We want to keep ourselves safe as well as we move into Exalta Health. How would you describe Exalta Health to one who needs to know?
Sure. So Exalta Health has been around since 1996. We started as a medical center trying to give a quality, accessible healthcare to the underserved in the community. And slowly we have been grateful to have added throughout the years dental services, counseling, a chaplain as of 2017. And we are now a integrated medical facility, with dental, medical. Our chaplain is really important. We started out with volunteer services. Everyone that had started with Exalta was a volunteer, even our providers, and now have a staff of 39 and more than 200 volunteers. So we are very grateful, and we're excited to tell you more about who we are and what we do.
Bet we've an hour to do that. Eva, why are you volunteering your services for Exalta?
Like I said before, it really takes on that bigger work of helping families like mine. Being in the heart of the community, right on Division, being accessible. If you don't have a car, if you don't have transportation, we're right there. We are part of the major bus routes. You can come access us, but we're also very diverse in the community that we serve, and that's why I serve, and that's why I give back. It feels good to know that I am helping a family that maybe is struggling like ours once did.
Thank you for that. Of course, we will be meeting artists, but there will be some celebrity opportunities. So, some celebrity artists. So you have a favorite maybe, or one to talk about?
Well, I don't know. I don't want to say favorite. I don't want to get anybody mad. We do have more than 40 local artists that have come together to donate their artwork and be able to give us the opportunity to bid on this artwork. All of the proceeds will help our organization and the mission that we are carrying here today. But we do have 6 celebrity artists. My I think the more notable one, I'm gonna go with that wording, is Terry the Boar. She is one of the celebrity artists, and I can't wait to see what she's got and to see what her artwork will bring into this organization, and really truly that impact in our community and the healthcare services that we're providing.
What do you tell someone who needs services and yet is anxious about walking in the front door of Exalta Health? Why should I walk through the front door?
Yeah, we are approachable. Like I said, we're in the community. We're right there. You can just walk in. You don't have to necessarily go to the website first or go and pick up the phone. If you're curious, walk in and just say, hey, like, I want to learn more about you and find out more about us. You can go to exaltahealth.org and find out more about us as well. And we're everywhere. You know, our board members are hitting us up on Facebook, LinkedIn, and we're just everywhere kind of trying to tell everyone the story, and we're all from different walks of lives, from different areas and different sectors. So
why should we support Exalta Health?
We're doing great work. We are giving access to quality healthcare to the community. Support, really, healthcare has always been in top of mind in our communities. Even so, more now, I think it's important to continue to support the work that we do here, specifically for those that maybe are not insured or that don't necessarily know where to go. We are here in the community. We're visible. Come in and just be part of the community with us.
Great. Thank you for your service as a board member, Eva Alexander, and of course, thank you. We've kicked off ArtFeast9. Now we're going to show you an artist. Take a look.
Hi, Ann.
Hey, how are you?
I'm good. Thanks for joining us and being willing to talk about your art. Can you tell me a little bit about what inspires you to create art?
Well, you know, it's okay, so it's funny. Since I was a kid, my mom always said, oh, Ann, you're an artist, and my friends all said that too, and I thought that they were just saying that to make me feel good, because to me that was the highest honor. And it turns out, I guess I am an artist, and it's just part of me. You know, I've just always been a happier person when I'm making art, and when I'm doing it, it just kind of flows for me. I'm not even necessarily thinking about it when I'm making it. I'm just doing it. It's kind of interesting. So what inspires me is my happiness, and also it's just I feel like it's something I was put on this earth to do. And but beyond that, my art has taken off enough in the most recent years where it's in hospitals all over the country, and I get letters and emails from people who will write to me and tell me, you know, I saw your art on the hospital wall when my baby was born, or I was in the radiology lab and really nervous about what was I going to find out, and I was looking at your art and it made me feel better in some way. Recently, a friend of mine, like just this last week, told me he was getting a brain scan, and he looked up and he saw my art, and he said he just felt like, oh, you know what, it's going to be okay. And so I do think about those things, like who is going to see it and what their situations are going to be in sometimes, and I just want them to feel powerful and happy and full of joy, and I think of those things when I'm making my art.
Yeah, it's very beautiful. It's very
Thank
beautiful. Tell us a little bit about what led you to donate to Exalta's Art Feast.
Because what you guys do, you know, helping provide health care to people who don't have health care or don't have those resources is so incredibly important. You know, I'm lucky enough to have health insurance and to be able to pay for my own health insurance. But I mean, it is so expensive, and so many people just don't have it. And if I can provide my art and in some way help somebody else be able to get health insurance because of that, I am all in. And you know, I think what you guys do is so incredibly important.
Well, thank you. And I do thank you for taking time out of your day to come and talk to us and tell us about your art. And we look forward to many years going forward.
Thank you, and I'm very happy to do it.
Thank you. Hi, I'm here today with Julie Quinn. Thank you, Julie, for joining us.
Yeah, thank you for asking.
Tell us a little bit about yourself.
Well, I just turned 63, which is a big deal for me.
Congratulations.
It's kind of a difficult birthday, but it's been a pretty good year so far, so I'm doing okay. I've been painting for about 35 years and have never actually had an art class in my life. I'm completely self-taught, and it's gone from being just a hobby of mine to being a full-time career, which I love. And my studio's in my home, which is really nice. I get to work from home, and I really enjoy that as well.
That's beautiful. What is your inspiration behind your pieces?
Inspiration behind my pieces is they're very deeply spiritual for me, very deeply intuitive. This is a little bit of a departure from what I normally do. My work is actually my prayer language. It's like a visible prayer that I create to hopefully minister to others, to people who see it. For this year, though, I chose to do some flowers. And I think at some point, every artist, no matter how you paint, does flowers at some point. And I think there's a reason for that. Because you can't look at a flower without feeling some kind of hope or peace or joy. You know, we give flowers on happy occasions like birthdays and celebrations, but it's also why we give flowers when people are going through difficult times in their lives, when they're ill or if there's been a death in the family. So I just feel like it brings a sense of hope to people. And if there's one theme that runs through all of my work, regardless of what I paint, it's hope.
That's beautiful. You've been involved in ArtFeast for many years. How many years have you been donating? And tell me what motivates you to donate to us.
I believe I've been donating for 7 years, and I always feel privileged to be asked to donate for Exalta. The thing I love about Exalta is they not only minister to people's physical needs, but they do such a wonderful job of ministering to people's spiritual needs. And I think that's just as important as, a person having, dental care or vision or having their physical needs met. It's just so deeply important to minister to a person's spirit. It's all so deeply connected. And I've always had a heart for ministry. I worked as a social worker actually for many years. Actually in this neighborhood, I worked as a case manager with the mentally ill homeless population in Grand Rapids. So I've always had a real interest in serving that population. And so now I'm just doing it in a different way. And I feel by donating, I am in some small way helping to minister to these people who have such a great need that needs to be met.
Well, thank you. We appreciate your gift, and we appreciate your heart for the people that we serve. We couldn't do what we do without people donating to Exalta, and so we appreciate it so much.
Well, thank you again for asking.
Happy to have you here.
And what an artist profile. There are more to come, but boy, we start strong with that talent. So here we are, ArtFeast9, we continue, and boy, we continue with a very important person because she is our medical director, Dr. Laura Vander Mullen. In the house, how are you feeling here?
I'm excited. I love ArtFeast.
Very nice.
I particularly like the food, so I hope the coupons are good.
There we go. Well, congratulations on your success. You've touched a lot of lives. Tell me basically your role with Exalta.
So I started with Exalta probably 20-some years ago as a medical director. Prior to that, they had a part-time medical director, and a few volunteers. And as the services grow, they were looking for someone who could commit a little more time. And I was crazy enough to do it all those years ago. Just a little bit of my story is I had loved overseas work and liked being in different cultures. And when I came back and was looking for jobs in Grand Rapids, one of the doctors came to me and said, "You can have that in Grand Rapids." And I was actually like, I don't think so. And they said, no, there's a clinic. They called, at that time we were Health Intervention Services, but yep, Exalta has lots of different people. And I get to speak Spanish probably 80% of my day. So, you know, for me with faith, God gives you the desires of your heart, and I get to serve the people that I dreamed about serving when I was a little kid.
Wonderful. Well, you shared the math, 20 years. What would you say would be a couple of significant changes over the last 20 years with your Exalta Health?
Yeah, so I think initially, you know, it kind of grew grassroots. There was a need for medical care, so that was kind of where we first started. And then as we saw our community, quickly we saw that dental care was very much needed, and we started looking for dentists who would volunteer and raising money for dental chairs. And then once you started to see people and hear their lives, you realize that we are more than just bodies and mouths. We have spirits and emotions, and so we grew into this integrated model where we really try to take care of the whole person with behavioral health, spiritual care, dental care, and medical care.
Very nice. Let's zone a little bit in on the dental care. Talk to me. Obviously, it's good to replace a tooth, but do you want to focus perhaps on some prevention?
Yeah, I'd love to. Dental care is a huge need, probably more than medical. And we've ended up having to pull a lot of teeth instead of care for teeth. So one of the things we committed to early on was having hygiene. And hygienists teach people how to care for their teeth. So that's so important. It's getting upstream in that dental issues. And so we have 2 dental hygienists that help clean teeth. Sometimes mouths are so difficult to clean, they actually clean a quarter of the mouth at a visit. But we see a change. We are saving teeth. And that has to feel good to the dentist to not always have to pull. However, if pulling is needed or dentures are needed, Daniel Armstrong can help out with that, and Fred. We have 2 dentists, one part-time, one full-time, who are able to help people. Dental pain is a huge issue too, so we're able to get people out of pain and have them have beautiful smiles, because we all know what it's like to not want to smile because you got something in your tooth or you're missing a tooth. So that's really important.
Great. Well, I know you have a long waiting list, so bring those who, with their talents, to the forefront. I want to talk about, well, the future. Number 1, do you use students? And number 2, have students come back to work?
Great question. So, yeah, you know, I do plan to retire. The sooner the better some days.
Bulletin, breaking news.
And we've been able to have students almost in every area. We have dental hygiene students, dental assistants, medical assistants, medical billing and coding students, nurse practitioners, PAs, medical students. And actually we have seen, like I have Kurt Ashak from Dermatology Associates. He was a med student at the clinic years ago, and now he's in private practice, but he volunteers by letting us send some of our patients to him. So we have come full circle. And I have other ones that I have another nurse practitioner who came back and volunteered, who had been an NP student. So that's delightful. I keep saying I'm training my replacements.
Yeah, that's called the circle of life. That's okay. How about specific programs you'd like to share?
So again, some of this is because we're small and we can kind of see where the needs are. We developed a women's health physical day that I've talked about before. We were able to care for refugees. We're now one of the places that refugees can come for their initial physical exam, and then we hope to give them health care as they stay and establish themselves if they stay in Grand Rapids. One of the other areas that we've been able to do that's difficult is we've been able to give unaccompanied minors their physicals. And I think about how frightening it must be to be 15, 16, or 17 in a country where you don't speak the language, you're afraid, and then you have to go to a place and get vaccines and have a physical. And so we try to make it a very safe place. I feel really blessed that most of our staff, many of our staff are bilingual, so we can speak at least the language of many of the unaccompanied minors. I will give a little shout out to Voices for Health. When we do refugee care, we have their interpreters come, because it's really important to try to connect with people in their own language. It definitely has taught us a lot about intercultural medicine.
Are you working with chronic conditions such as diabetes or hypertension?
Yeah, so part of one of our two largest diagnoses are hypertension and diabetes and obesity. And we've been able to get some grant money and partner with Healthier Communities and some of their programs to try to see if we can find a way to help those people help manage their chronic illness instead of us just giving numbers, trying to empower them to pick healthy lifestyles. The other really fascinating one is we've been working with Metro Health on telehealth and possibly having subspecialty visits be first telehealth, because so many times our patients struggle getting to their specialty care because it's a different office, they don't know that person. So our hope is maybe if they had an interaction through telehealth and they needed another study, it would be an easier transition.
Speaking of Metro, Dr. Peter Hahn, one of your celebrity guests, so there's a nice tie-in.
Correct.
Lastly, would you share your use of volunteers?
Yeah, volunteers have been the backbone of Exalta Health through the years. There's myself, I'm the medical director, I do see patients. We have a staff physician, Shoemaker, but really all the other hours filled up by the clinic are by volunteer providers, whether they're other physicians, nurse practitioners, or PAs. And what I think is amazing is some of them have come year after year. They're committed. We usually at least have them come once a month. And they can give continuity of care to patients, which is so important. Our nursing staff, we have a very small nursing staff, and yet with our volunteers, we're able to service so many more patients. So, and I know dental feels the same way about their dental hygiene volunteers and their dentists. That just allows us to grow capacity without increasing salaries. So it's just a huge blessing.
Wonderful. All right, why support Exalta Health?
Why support Exalta Health? Because medical care is so needed and it's not cheap. And we are treating people with dignity. They are made in the very image of God, and we want to give them medical care. And you partnering with us helps us give great medical care, great dental care, spiritual care, and behavioral health to people who otherwise may never seek it out or receive it.
Great. Thank you to you, Dr. Laura. And thank you to you. Let's take another look at an artist.
All right.
Hi everyone, my name is Eva Alexander. I'm a board member at Exalta Health, and I am here today with Kathleen Bechtel. Kathleen, you are an artist for ArtFeast this year. Can you tell us more about this beautiful painting we have in front of us?
Well, this is a lake actually in Rockford that I painted it from, but I am always drawn to the lakes, to the water, the calming effect that nature has on all of us. I think that's just a human thing.
Yeah, it's beautiful.
Thank you.
Tell us more about yourself.
Well, I work in oil. I used to work in pastel. I do portraits and still lifes, and most of the time I do landscapes. Mm-hmm.
So why Exalta? Why donate this piece to ArtFeast?
Well, I think it's important. I think it's part of our mission as people because life is so fragile and it can change so quickly, and certainly we've all seen that during COVID. And so I think it's a responsibility of all of us to step up when we can. Yeah.
And so here it's your first year doing this?
It is.
Yeah, so
right.
what made you take that jump and come and join us?
Well, I heard about it through River City Art Solutions, and they asked me if I wanted to be part of it, and I read your mission statement, and I absolutely wanted to get on board.
Absolutely. This is also my first year as a board member, and that mission really pulls at you. It's accessible healthcare.
Yeah.
Really something, isn't it?
Yes, it is. Yes, it is.
Well, thank you for joining us today.
Well, thank you so much for giving me the opportunity.
We are back with Eric Garcon. Eric, tell us a little bit about yourself, what you do in your artistry.
Well, I'm a makeup artist. I've been in the industry for over 14 years. It's been a long journey, but it's so rewarding. I get to work with a lot of organizations, donating my artistry, and yes, I'm from Mexico originally, and I moved to Grand Rapids about 15 years ago. So yeah, I've been doing this for a long time.
Awesome. Well, I follow you on Instagram. I know that your art is beautiful.
Thank
How
you.
long have you been helping us out with ArtFeast?
I believe it's been 4 or 5 years, and it's just an honor to be part of this project, because I think what Exalta is doing for the community is amazing. Not only I offer my services as a donation here, but I work with other organizations because I just like to help the community, and whatever I can do, I'll do it.
And so you mentioned a little bit about this, but why Exalta?
Like I said, it's I feel like what they're doing right now to help the community, people that are struggling, especially at these moments with COVID. I feel like people are really struggling, so I feel like this is the moment that we should get together and help each other.
Yeah, I absolutely agree. I am also from Mexico.
Oh, you are? Oh, nice.
So it's great to see you here. I was also inspired by the mission of Exalta to have accessible healthcare, and really because of my background and where I come from, I also believe in that mission very, very much. So tell me more about yourself. So you're from Mexico, you came here a few years ago, and
well, I've been here 15 years ago,
Yes.
but it's been just a couple years. But it's been amazing to work with local people. I do not only theatrical makeup. When I work with you guys, I usually do body painting, but I started doing theater makeup, and that's how I got into the industry. Then I branched out and I started doing beauty makeup. I do a lot of weddings, so I do a little bit of everything. TV, I got my hands in film, so it's great. I love it.
so how can people find out about you?
Through my website, ericmakeup.com, or my social media, which is the same, Eric Makeup. They can find all my craziness, and my work is there. I also provide makeup classes, like makeup lessons for people that want to learn how to do their own makeup. And I also, I'm an educator for salon owners, business owners, stylists. So yeah, they can check me out through my website.
Well, we're very thankful to have
Thank
you
you.
here and to have you at ArtFeast. And
Thanks
so much for joining us.
Thanks for having me.
And here we are. She knows all about the money, and it's important because that's why we're here at ArtFeast. First of all, kudos to this past artist we just saw. I don't know, I think I might be bidding on that. I'll see if I can outbid you.
That's good. That's good. That's what we want.
It is all about, obviously, the dollars we bring in tonight on this ArtFeast9. I have the honor to introduce you, Mutiala, on behalf of Exalta Health. You are the advancement director, which means you have a big job.
Yes, I do. You mentioned before that I'm the money lady, and that's exactly what I do. I try to raise funds to support this cause, and we do it in different ways.
Right, because Exalta Health is a nonprofit, and then certainly you depend much upon the community, I would think, to pay for the necessary services. So throw out some stats for me if we can. I mean, you serve both the insured and uninsured.
Yes. It's Exalta Health is a nonprofit, and we have uninsured people who have insurance but have covered very little, and so we have, our big numbers are 72% of the patients who come through our doors, they have not insurance at all.
No insurance.
No insurance, and so it's difficult. We all know how difficult and how expensive medical care is, but we will never take away or turn away, I should say, anybody because of lack of funds.
Mm-hmm. Yes, and we mentioned the Hispanic Latino population as well, right?
Yes, about 63% are considered Hispanic or Latino, and I would say 50% of those will go through the doors without knowing anything except Spanish. Mm-hmm. So our staff is bilingual, and we also have the help of volunteers interpreting for us as well.
Yes, and to have as much integrated service as you do with the dental, with the medical, with the behavioral health, so important these times.
Yes. You know, we have especially parents who come with little ones, and they tell us this is their medical home, and so they take care of medical and dental in one shot, in one visit, and how important it is for them to be able to care for their children. And sometimes because of the insurance, they will take care of one, medical but not dental. And so now in our Exalta Health, everything is taken care of.
Wonderful. Well, again, we depend upon the community, those of you out there supporting ArtFeast9, but you also depend upon the community and the partnerships. You want to talk about a few?
Sure. We couldn't exist without our donors who donate in a regular basis or yearly, but we also have community partners. We have the hospitals around that support us and what we do. And we also have foundations through grants that will help us continue the work. In fact, one of our artists is from a local hospital, Metro Health. So.
Yes, he's a big deal.
Yes, he is. And we hope that he will bring a lot of money for us.
I was going to say, that's the bottom line. So Metro Healthier Communities is also an important partner.
Spectrum Health has been with us for many, many years. And so year after year, we have different grants and different gifts given to us to continue the work that we do. Especially we do chronic diseases management through some of those grants.
Yes, and you mentioned multiple foundations have stepped up to the plate, believing in your product.
Absolutely. We have foundations that have supported us through the years, and some of them we only write a letter and explaining, okay, this is what we need for this year, and we receive, the gift through them.
Wonderful. If someone is interested in becoming a donor, what's the process?
Well, they can come and see me. They can go to exaltahealth.org, and you have all the information. You can call the 616-475-8446, and then they will direct you directly to me. I will love to meet some of you who are interested, not sure what to donate or how or why donate, so we can sit down and with a plexiglass and talk.
That's what we do now.
Yeah.
You obviously have the ArtFeast9 Exalta Health brand, so believing in your product. And so I ask you, why do you support Exalta Health?
Well, I've been with Exalta Health for a year as a staff, and I had a friend who shared about Exalta Health. I went to a luncheon, I visited the clinic, and I was hooked up to Exalta Health. I believe in what we do. We serve people who otherwise would go without health care, medical, dental, and we have staff and volunteers who love our people. and there is so much love shared there that I want to be part of that.
Wonderful.
Absolutely.
Well, you are part of this tonight. Looking forward to seeing another artist here shortly, and certainly looking forward to continuing the conversation. So thank you very much.
Thank you.
To you, Mutiala.
Thank you. You got it right.
I know that. Good teacher.
Yeah,
Thank
thank
you.
you.
Here's another artist.
We are back, and this is Roxanne Middleton. Roxanne, thank you for being here today.
Thank you for inviting me again this year.
Yeah, so you say again this year. Tell me more about that. How long have you been involved with ArtFeast?
We have been involved with ArtFeast for 4 years now. Yeah, this is our 4th year.
Wow.
Yeah,
and
we're pretty excited to be involved.
nice. And so tell me more about your art piece and what inspired you.
Well, I'm going to call this Pretty in Pink. We have a little sparkle. We need a little sparkle in our lives right now. We need a little inspiration to make it a little bit brighter.
I love that. And you are pretty in pink today, so
I know.
matching your art piece. Tell me more about yourself.
I have been doing leather work. I carve and tool. I do soft leathers for forever. I'm 65. I've been doing it since I've been 12. I teach. I do a lot of special needs, adults and kids. I do a disabled veterans group. So I've been doing leather just forever.
Good. Well, we're excited to have you. And tell us why donate to Exalta Health.
I got involved 4 years ago via Gail Holworth, who's a photographer artist. She invited me. Actually, she was a presenter there, and I came with her as a guest. And so the next year, we talked to everybody, and I said, be sure and invite me next year. So there we go.
So that's how you got started.
The mission, yes, yes. And I love what you do. I love what you do for the community and the people, and it's a passion of mine to support.
Thank you. I know it's a passion of mine as well. Compassionate, accessible healthcare is definitely something that we all need, and that is helping the community. So you talk about this piece, and it's pretty in pink, and you've been working with leather for a long time. What inspired you, and maybe do you have a partner in this?
We do. Our business is Middleton Markoski Designs. My partner is, we're both retired. We say we both work in our basement, so to speak, especially with COVID, we don't get together too much. But she is a metalsmith, so she does a lot of metal work. She sets stones, things like that, and we're about 5 years in. We just saw each other's work at a shop in downtown Newaygo, and we just said, I can put your work on my work, and there we went. So we do a lot of stuff together as collaboration.
Beautiful. Yeah, we can see it here, the leather and the metal work.
Yeah.
So thank you so much for joining
You
us
are
today.
very welcome.
Welcome back. We are here with Barbara Schilling. Barbara, thank you for being here today.
Thank you. It's a pleasure to be here. I really appreciate the opportunity.
Yes, we're excited to have you. Tell us more about your piece, your artwork. And
Well, this particular painting, the name of it is Ginger Jar, which is, rather self-evident there, but to me it has a real sort of almost sentimental feeling to it. When I think of ginger jars and that type of porcelain that was really kind of more popular back in my grandmother's day, and so it sort of brings back these very warm, sentimental feelings for me. And I just thought that during this time, when we are struggling in so many ways, that kind of looking back at sort of a quieter, more gentle time in our history was, just a nice thing to do. So, that's what I thought of when I chose this piece for the auction, and I do hope that that is something that whoever purchases it is able to look at it and enjoy it and kind of get that same sense from it that brings back good memories and good feelings.
Absolutely. Simple times, quiet times.
Yeah, what are those like again? It's been a while.
I love that. I love that this piece conveys that. So tell me more about yourself.
Well, let's see. I worked in art restoration conservation for over 30 years. I had my own business for about 12 years and then went to work for Frames Unlimited, a local company, and worked with them for another 20 years or whatever. About 3 years ago, I retired from doing the restoration work, and although I've been an artist really my whole life, that was when I was able to start really concentrating my time and my efforts on really marketing and studying and producing my own work.
That's exciting. I know it's exciting for us because you've been helping us out for a while, right?
Yes. It's a great opportunity to be able to give to the community, and I think that's so important. Especially those of us that have been very blessed, and certainly I have, and to be able to share in some way those that have been less fortunate or have just for some reason struggled in the way things have been this past year especially, it helps me feel good to know that I am able to give, but certainly I think that Exalta is a wonderful organization.
Thank you. What about others? Why would you encourage others to give to Exalta?
Well, there is that real personal sense of doing good, and certainly that's the more selfish aspect of it. But it's there. If you want to feel good, do something good for somebody else, and I feel that Exalta is a good opportunity for that.
Absolutely. Accessible healthcare is what we're here for, and thank you for helping us bring that to the community through your artwork.
Oh, absolutely. Happy to. It is my privilege. Thank you.
Thank you.
And yet another beautiful piece of artwork. Thank you very much, local artists preparing their talents again for us. In this ArtFeast9, slowly winding down, but a lot of time left in our world. I bring you back on, Dr. Vander Mullen, we haven't shared any real heartfelt stories of those from the community, and I ask you to do that because permission has been granted. Share a story.
So, stories kind of bring the place to life. So, on almost any week, we can usually give you a story. I can tell you just this past week, I had a young refugee come in for a second visit, which is really promising for me because that means there was a connection made at that first one when they have to come in. But to be able to give care to them in the future, a connection has to be made. And that patient came back in, and I thought it was the sweetest thing. She looked at me and she said, I have this issue. And then when she was done with that, she said, am I allowed to ask you another question? Is that allowable? Through our Voices for Health interpreter. And I just thought, I'm your doctor. You get to ask me whatever you want. And so I could smile at her and I said, you know what? You can ask me more than one question, and you can even tell them when you schedule that you have issues and you need a longer visit. And she just got, I know she had her mask on, but she had pulled it down so I could check her out. And she got this big smile on her face and she said, I have another question then. And it's been something I've been wondering about for years. And I thought that's why we do what we do, because to be able to give care to someone who's had a question, a medical question for years and never been able to ask that question is just powerful to me. So we would get to walk along with her now and give her care.
Another story?
Another story. This one I'd like for you guys to think about as you hear it. what it was like in medicine when we didn't have behavioral health and spiritual care. And this comes from Chris Shoemaker, who's a great physician. I love working with him. And just his care for people. He had a patient, Sean, and we do again have permission to tell Sean's story, but way back in Sean's teenage years, he started with chronic back pain, and it soon became debilitating. He had moved out, he was independent, living in Arizona, and he found himself unable to do his job and ended up having to move back home, move in with his mom. His life was just falling apart, as he puts it. He gained weight, he started to seek treatment through street drugs and alcohol, and walked through our doors in 2015. And at that point, you know, as Chris said, I could give medical advice, I could try to figure out what the problem was, but you knew that that problem was deeper than just what his physical needs were. And then as we added, you know, behavioral health and Kristen, our spiritual care, like for Sean, a simple interaction of Kristen walking alongside of him while his dog was dying and praying for he and his dog has been something he has talked about over and over, as just that feeling that someone cared and that they would be willing to take that, as we would say, to, you know, to prayer and to walk with him through that. And then with his time with Ken, one of our behavioral health staff workers, he's been able to work through some of his anger issues and finds out that some of his pain was related a lot to some of the emotional issues that he had. And so he is now off of all opioids. He has lost weight. He's learning how to exercise. He actually is looking forward to being independent again. And for the first time in a lot of years, is dreaming about what he may do in the future. And I think that, you know, that's not done by any one of us at the clinic. It's a team, it's us coming alongside people and using the gifts that we feel God has given us to walk along and give what we can give and do what we can do well, and allowing other people's gifts to just help, you know. And it's been that's a powerful story. Not all of them are like that, but you don't know where any one of those people are in their stories. And so we are going to be long-suffering people. And we're going to walk with people till hopefully they get to that point where Sean is. And so those are my two stories for you.
Yes, I'm sure there are many more stories, and it's important to, of course, witness the touching that you do in a positive way. Now, let's talk a little hard news. In these times, goodness gracious, how have you adjusted, presented, taken the silver lining of COVID in your clinic?
So yeah, COVID, you know, as you know, it hit communities like ours very hard. The Latino Hispanic population was hit hard, especially those who were essential workers, which many of our patients are. And they also live in multi-generational homes, so they had lots of risks. That being said, one of the exciting things is that there has been concern about vaccine hesitancy. But through the health department, we've been able to have vaccine at our clinic, and we've given over 700 vaccinations, or about 700 vaccinations. And so I think, you know, when you've been in a place and in a community, and you know, our motto, our community, our health, is really key, and we have been a safe place, and we've been able to have lots of people come and get vaccine, and that's just exciting. And you know, the vaccine clinics have this air of kind of hopefulness. Like, I've had quite a few patients who come in, and some of them are just from the community who've literally teared up when they get their vaccine, and they've said stuff like, you know, I'm on my way to hugging my family. We're gonna get better. So I think it's just a powerful thing. And for the providers, for those of us who've actually given the injection, you finally feel like you're doing something in this disease that has kind of beat you down on kind of feeling like I can't fix this, I can't get ahead of it. When you give that vaccine, you're like, we're on our way. We can do this as a community. We can do it as Grand Rapids, as a state. And what's really interesting is this is a worldwide pandemic. We need to be cheering on everyone in the whole world to beat this. So,
But to know you're doing your part right here in West Michigan. Exalta Health is as well. And you have been doing your part. We're coming to the end of our ArtFeast9 as we, slowly say goodbye. What a fun adventure. All the artists, all of the you who have shared how you spend your days at Exalta Health, and of course asking why support. So with that said, we need to continue the conversation, not only checking out exaltahealth.org, but maybe praying, maybe volunteering, maybe donating more money, if you want to be blunt, because it does come down to some financial support to support.
Yes.
So without further ado, this wraps up this Art Feast 9 edition.
thank you.
Thank you very much.